So when patients unfortunately fail radiation therapy, and if their physician, whether it's a urologist, medical oncologist, or radiation oncologist, decides to put them on hormone therapy, or what we now call androgen deprivation therapy, without ruling out local disease as their only source of recurrence, I think this is extremely unfortunate because you're, number one, removing the opportunity for permanent cure. Hormone therapy does not cure prostate cancer. There's no data to suggest that hormone therapy cures prostate cancer. We know it puts the cancer cells into what one would describe as a state of remission. But if a patient lives long enough, more than a few years, invariably over 90% of these patients will develop what we describe as androgen independent or castrate resistant prostate cancer. It means the cancer cells are smart. They figure out a way to beat the lowering of the testosterone level. So in addition to not curing the cancer, the patients are also suffering from the toxicities and the side effects of a lowered testosterone level. So what are these toxicities? They're bone demineralization, the high risk of developing a fracture, or what we call osteoporosis and osteopenia. There's potential cardiovascular implications. There have been several studies that have shown that there may be an increased risk of cardiovascular complications. Men also develop on hormone therapy obesity. In other words, they get weight gain, particularly in the abdomen. There's some very good data that men on long-term hormonal therapy also have impairment of their thought process, or what we describe as cognitive impairment. So if I can offer the patient a salvage treatment, i.e. cryoablation of the prostate, which is a one-time therapy, outpatient, doesn't require any drug or pill chronic therapy, then I really feel good about it. And once I explain this to patients, then they really understand it right away.